Let's talk a little bit more about other nutrients that you use. I know you've written a number of books and you've used lithium for quite a long while. And I'd like to. A lot of people fear lithium from a nutritional perspective. They think of lithium as a psychiatric medication. But can you talk about nutritional lithium and its importance and role in anxiety and other neurological and psychiatric problems?
Sure. Yeah, lithium has been a topic of mine, of interest, again, for almost 40 years. Um, and, what people, and I didn't realize is lithium is an element in the Earth's crust, so it's part of rocks. It's been around since the Big Bang 13 billion years ago, and it just settled in the Earth's crust. And so it's just a critically important nutrient for brain health. It's not just a medication. We think of lithium carbonate as a prescription medicine for bipolar disorder. And when we think about that, most of the time we think of side effects, right? Because there are side effects. Excuse me. So I don't use prescription lithium at high doses. I use low doses, and I use lithium orotate, which is a low dose over the counter lithium. And at these dosages, um, we have research to support improvement in mood and mental health and anxiety. Irritability is, I speak a lot about irritability in kids, autism and ADHD with low dose lithium. And some of the most exciting research is lithium, low dose lithium, and dementia. And one study being done in upstate New York is on Parkinson's disorder. So people are now kind of rediscovered lithium can be used at lower dosages for have profound changes to neurochemistry.
And so you've just seen a lot of really good outcomes using it. Do you test for lithium? Is there a test that you measure or run, or is this more, when you have somebody maybe who's struggling and not feeling better with nutritional support and diet change? Is this more of let's say like a treatment add-on if they're not getting better?
Yeah, I'd say most of my use of lithium is based on clinical decision making. But there's some method to that. One of the most important ones is family history. So, family history of addiction, aggression, or bipolar disorder just helps me sort through this patient might have a higher need for lithium. Um, and then I also look at clinical symptoms, irritability, mood lability, aggression, impulsivity. They might need higher lithium. And then also, I do look at a trace mineral hair test. So we can look at levels of lithium in the hair. And when I started this test 30 years ago, I'd say 60, 70% had normal levels. Now I would say 60, 70% have low levels of lithium in their hair sample. And I don't know if it's some toxin in the environment binding, getting in the way, or just everyone's drinking bottled water now where the lithium is filtered out. Most of
Yeah.
our lithium we obtain from tap water.
Okay. Yeah, and everybody's using heavy filters because tap water is so contaminated. So I guess, yeah, that makes sense. So talk to me a little bit about the symptoms that you mentioned family history, but what are some of the other symptoms that you see improve with lithium?
Yeah, the kind of most significant one that I would encourage people to think about because it cuts across so many psychological and psychiatric diagnoses is this concept of irritability, right? Irritability, somebody who's chronically angry and maybe with bouts of more aggression or disruptive moods, but irritability. And we see it in those trying to come off alcohol. We see it in certain individuals with depression, anxiety. For autism, they actually approved a medication called Risperdal, an antipsychotic not for the treatment of autism, but for irritability associated with autism. So I have found 2 milligrams, 4 milligrams of lithium orotate to work as well for some kids as this antipsychotic Risperdal.
You said 2 to 4 milligrams.
Yeah, I try to start everyone off at the more therapeutic dosages, which is around 2 milligrams, and then the 5 milligrams, 10 milligrams. I usually stop at about 30 milligrams for adults for lithium orotate.
Okay. Um, you mentioned medicine, Risperidol. Can you talk a little bit about some of the psych meds? I mean, I know there's a long list of them that are used, but part of my background is investigating, drug-induced nutritional deficiencies or other untoward nutritional side effects, like some of the meds can contribute to high blood sugar and diabetes. Can you talk a little bit about that? About just some of the traditional things if people are on medicine watching this, what are some of the most common medications, antidepressant, anti-anxiety meds, that you see people on that have nutritional consequences?
Yeah, I mean, I think it's sad that most people don't check any nutritional deficiencies before starting the medication. And we have good research saying low levels of things like folate and zinc, poor response to the medication. And then we have research saying you can augment the medications. I'm talking about antidepressants with folate and zinc, where the medicine works better. I think it's just been, psychiatrists just don't look at labs and don't look at that relationship that you're describing. So with the antidepressants, I don't think there are clear um, nutritional deficiencies that we repeatedly see. There are many that we see, so that's why testing is important. The one that I've been talking about a lot, um, that is clinically very relevant, is what happens when someone takes stimulants. So all these ADHD kids and now some adults taking amphetamines for ADHD. And I believe that disrupts the magnesium metabolism pretty dramatically and essentially causes a functional deficiency of magnesium. So a lot of the side effects we see on stimulants with kids, most of them can disappear with supplemental magnesium.
Interesting. So just and what kind of doses are you using, for that?
Depending on the age, but pretty much the therapeutic dosage we would use, for any other kind of nutritional intervention for, 400 to 500 milligrams per day, total for magnesium.
Or 500? Any particular form of magnesium you find more beneficial?
I've just been using glycinate for many, many years and it works. So that's pretty much what I stick with. Magnesium glycinate, twice a day.
Okay. Okay, twice a day. Um, what else do you commonly treat with nutrition? So we've talked a little bit about anxiety and depression. You've mentioned schizophrenia. Are there other common conditions that you see that you have found diet change or nutritional supplementation to be extremely beneficial for?
Well, I guess I would venture to say every psychiatric disorder, there's a role for this testing, looking deeper, functional psychiatry, and there's a role for diet and lifestyle changes. I mean, we have research showing a Mediterranean diet can improve depression. We have dramatic research showing ultra-processed foods increases risk of depression, anxiety, and dementia. And then, the nutritional research is is scattered all over the place, and nobody's kind of organized it into helping our clinicians understand it. But I can't tell you how many of the articles there are on low vitamin D and major mental illness, suicide, Alzheimer's, depression, but completely ignored. And there are some mental health clinics where the docs and the nurse practitioners aren't allowed to do these blood tests.
Why aren't they allowed? Is there like a stranglehold from the powers that be on the on the management side of things?
I've tried to ask. Some of it might be cost, in some systems. Other times they don't pay for the cost. It's just slowing down what we need to do, which is medication visits. It's really appalling.